The challenges that we're facing in the NHS are extremely serious.
There's a significant increase in the ageing population.
The number of 80-year-olds and the number of 90-year-olds is set to double in the next 5 years.
We're seeing an increased number of long-term conditions and increased range of complexity in the community.
And then we have the other issues of the growing burden of mental health.
They need more staff, and I think that's sort of evident with the waiting time.
Retaining staff and finding staff is always a real problem for us.
I know it's tight on funding.
I think that everybody is caring, they do the best they can, but I think they're all under a great deal of pressure.
We can't just carry on with the old system, and I think the time has come to integrate properly.
We are starting to realise that we've got to work together, that we've got to join forces to make a difference.
Together, working in partnership with the voluntary sector, we can do far, far more, and that's what this whole endeavour is about.
So the only way to actually cope with this and the growing demands on the system is that the way we all work in partnership.
It is very, very immensely important that everything is interconnected.
I fundamentally do believe that there's an opportunity ahead of us to achieve that, to achieve the outcomes that we want and to meet our ambitions.
But it does require, if we're going to really make a difference, a partnership with local government, a partnership with citizens to help them take charge of their health and well-being, and a partnership with the community and voluntary services sector, because they're out there in the communities working with people.
Joined up care ultimately is practical, it's common sense. When we've got the workforce challenges we have in West Essex, what we want to be able to develop is one route of entry, one point of assessment and one team.
So that individual that needs that care, they don't have to be chasing around everywhere trying to get it, that actually it's easy.
The One Health and Care Partnership is a partnership of all the health and care services in West Essex and East Hertfordshire coming together to work as one.
Our ultimate aim is to integrate services on behalf of the population, so they see no distinction between the services they receive. That could be healthcare, social care, voluntary sector, and even their own role in self-care and personalised care.
We believe that the One Healthcare Partnership is a new way of bringing all of the organisations together to work in a more collaborative way.
The One Health and Care Partnership includes Princess Alexandra Hospital, Essex Partnership University Trust, our community service provider, West Essex CCG. Essex County Council are also a key partner, as are our 3 district councils, a range of GP organisations, a range of voluntary sector organisations.
What we do helps to make people healthier, helps people to have treatment sooner.
We can all play a part in delivering a total health and social care package for people by thinking about how we break down some barriers, we work smarter, we consider creative solutions.
I do think all hospitals and all different councils should work together to obviously help people that need the help.
Between departments, I think it could be better, communication-wise.
Traditionally, I think the barriers have been how the organisations are formed, how the money flows, the way patients are assessed, the way teams work together.
So there's never actually been a normal way of talking to each other. So if you're in the council, talking to the NHS, that's always been naturally difficult.
What is exciting about this new initiative is it is going to create a mechanism for us to work together in the interests of our residents.
So I think relationships have always been fantastic in West Essex. What the One Partnership will do is remove some of the barriers that we have to making excellent relationships.
Take out the blockages. Just a simple example we're working on now is creating a shared care record which is consistent across this county and adjoining counties.
In terms of communication between teams, I think the multidisciplinary team approach has been really helpful. We take into account the views of social workers, nurses, doctors, therapists, patients.
So there's a significant number of initiatives that are underway within Essex.
Over the past year, there has been lots of collaboration. Our outcomes have improved.
I think more emphasis or more coordination is being done between the medical and the social and the community service that's provided.
We've got some really good examples already in West Essex of where health and social care have worked together well in partnership. We've got a single point of access, we've got integrated care teams.
There's some great pieces of work that are going on around disability.
We've got 2 pilot areas that we're going to highlight as our first steps into this new world. A musculoskeletal pathway, closely followed by a respiratory pilot as well.
I think the significant difference has been communication, understanding the different priorities of those groups within the NHS, or indeed the voluntary sector as well.
We should always look at people holistically. We should create the conditions which enable that to happen.
Yeah, I definitely think it's good that GPs and doctors in the NHS would have more of an open mind to treating people in a new way.
Most of the drivers of well-being and health are not about medical intervention. They're about how people live, they're about the services they can access, they're about the choices they make, they're about healthy lifestyles.
And there are such a lot of other issues that impact on the person's well-being, their housing, their education, the social situation.
We believe that the lived experience of the patients, the partners, the carers, the family members and the staff are hugely important. And our drive in everything we do is about making that the heart of everything that happens within health and social care.
Some of these solutions aren't going to require a treatment. So how can we actually think about mobilising communities, people and the voluntary and community sector to provide solutions, activities, services, preventative pieces of work?
There's tremendous capacity and capability and enthusiasm in our community and voluntary sectors. We think they have an absolutely central role.
NHS could only do so much.
Patients are actively involved. We have some really strong patient participation groups across West Essex, and they engage with our services and they provide advice and guidance.
I believe strongly that the voluntary and community sector can support health services. We have the access to the individuals and we have their ear.
We have incredible volunteers and we have tremendous goodwill. So I think the opportunity to formally, which is what this initiative does, tap into that is immense.
The pressure in primary care is growing. So it's important we get people going to the right place. This comes back to the single point of access, and they would be triaged to go to the right place, which might be the general practice, it might be the pharmacist, it might be the dentist, it might be social prescribing.
Patients come to hospital who don't necessarily need to come to hospital, and we need to support primary care and community services to be able to have the resource and the skill set to be able to manage those patients effectively.
We have to look at the way we do well-being within employment. So me as an employer, I have to look at the staff and the volunteers and how we keep them well.
Can we be doing more about prevention? That means we have to be much more interested in addressing the causes of ill health, not just dealing with their consequences.
I see patients as a practitioner of their own healthcare. We really need to push the self-care and personalisation agenda. We need to motivate patients to self-care and manage their own condition.
The future really is predicated on patients taking responsibility for their own health.
Well, I think it's important that all of us take responsibility for our own health and our own mental health as well.
People need to make sure to take care of themselves before going straight away to a doctor or to A&E.
It is important for people to take care of themselves.
I do think there's a lot of abuse. I think drinking and drugs is a big problem for the NHS.
You might get someone going doctors for years complaining about a cough, but then they're still smoking. And I can understand when the NHS then would be like, well, look, if you're really that concerned, stop smoking.
We all have a role to play in taking our own health seriously.
I think patients realise that we're all in this together. We all have to play our part to ensure that the NHS is sustained.
The One Health and Care Partnership is the platform that will enable us to do that.
And working together as one will make a really significant difference to how we provide care, how we improve our experiences for our patients.
I think that success will come by about people committing their time and committing their responsibilities and their budgets and their staff to making it work.
We are determined, energetic, we believe in it, and we have the drive to really push that forward.
Is beginning to feel different. The movement has already begun.
What I hope the One Health and Care Partnership is going to do is bring together the very many different organisations that can play a part in ensuring that every single person, young, old, born here, arrived yesterday, has the very, very best possible life that they can have.
And as long as we can show that we've listened and we've tried to do our best for them, then I think the partnership will be a success.